This is a very brief review of treating the T1 segment, and of course you've got those stout little first ribs with lots of muscular connection, and the shape of the facet is changing from that of a cervical facet shape changing towards that of a thoracic, and I would submit that side bending and rotation occurs in the same direction because it has similar properties to the cervical spine. The T1 segment can get stuck in rotation, and it can be subtle, and it requires a little bit more effort to free up that segment, and sometimes it is missed when a generalized mobilization, manipulation treatment is part of what they're doing. And it's important to test it in flexion, test T1 for rotation, and also test T1 in extension. Now, if the first rib has a mobility impairment, then that can perpetuate the rotational dysfunction at T1. So it's always important to treat the rib joints on both sides. Sometimes it's only needed on one, but evaluate both sides. Free up the ribs as best you can prior to treating the rotational dysfunction at T1. And that concludes my review of first thoracic segment.